So thank you everybody for joining us. My name is Steve Schrag. I'm with the Connecticut Council on Occupational Safety and Health. Pam, you want to introduce yourself?
Hi, I'm Pamela Puchalski, and I'm the Assistant Director of ConnectiCOSH.
So if you want to put the answers in the chat, you can do that. These are a very quick survey about SARS-CoV, and we're going to also be covering workers' rights. You can contract SARS-CoV by A, inhalation, B, eyes, C, nose, D, mouth, E, skin. You can pick whatever choice you want. Number 2, how many ways can you use to prevent getting SARS-CoV? 1, 3, or 5. There are no federal legal regulations to protect workers from airborne pathogens. Is that true or false? So if you want to put your name and put what your answers are to those 3 questions in the chat, you can do that real quickly.
I can, Steve, you can't see the chat, right?
I can't see you. If you could check
Okay.
the chat, Pam, yeah, that'd be great. Pam, you want to say a word or two about what ConnectiCOSH is?
Sure. So far, I don't see anybody putting anything in the, oh, we do have our first one. Thank you, Bill. But while everybody's doing their little survey there, so ConnectiCOSH is a nonprofit, and we're a worker health and safety organization that believes that the best way to keep workers safe is to educate them. We also do a lot of advocacy for workers who are, having issues in the workplace. And that's our goal, is to keep everyone safe and healthy and able to go home the same way they left their home in the morning.
So the objectives for this is to provide you basic information regarding SARS-CoV and ventilation systems and workers' rights, encourage discussion to identify concerns and possible solutions, and inspire you to take information provided and take action. It really isn't as important as what we do here is what you do when you go back to work. Because our goal is to make sure that you actually are safe, and just giving you the information is the first step, but it's not the only step that's going to make you safe at work.
So Steve, do you want to go back to the survey, or do you want to know what people said?
We could do that.
Okay.
There we go.
Okay, so let me move this chat over. So the first one, you can contract SARS-CoV by, a lot of people said A. A lot of people for number 2 said B. And for number 3, quite a few people said, well, some people kind of said A, B, C, D. That's interesting. Well, we have a few B's, but okay. So
the answer to question number 1 is you can contract SARS-CoV. The most obvious and most common one is A, is inhalation. In theory, eyes, nose, and mouth, if your hands were contaminated and you touch them, you could theoretically get it that way. That is the least common way for mode of transmission for an airborne pathogen like SARS. It's an airborne pathogen, and inhalation is the most important way that people get it. I think because there's been such a focus on cleaning things, some people think you can get it by getting it on your skin. You can't. It's not like a chemical. It's not going to go through your skin into your bloodstream. You need to get it directly into your system. So eyes, nose, and mouth are much less likely, but they're theoretically possible. The most common way is inhalation. Number 2, how many ways can you use to prevent?
Did Steve freeze or did I?
I don't know. All of a sudden I had a problem.
I
too.
think-
Looks-
I
I
think
think
Steve
Steve
froze.
froze.
I just
Okay.
checked mine too. I just checked
I
mine.
thought it was
Yeah.
my battery
We're
too.
all
Yeah, me
moving, so
too.
it's gotta be Steve.
But then I saw you all, so it was weird.
Yeah. All
So
right.
hopefully he plugs in.
Across the screen, it said your battery is getting very low, and maybe that was his battery. Now
I
he's
think
done.
so.
Let's just give him a second. That happened to me the other day. I was on a call and all of a sudden screen went black and I said, okay, I guess it wasn't plugged in appropriately. So I had it plugged into my computer, but the cord wasn't well connected.
Mhm.
So it took me a minute to get back on, but I was able to rejoin. So hopefully he'll be back with us in a second.
It has been a lot of years for me, but to see a test like that or questions like that in a group full of nurses, and the very first thing I'm saying, oh, great, this is going to be like taking tests in nursing school and people arguing over every point. Every question, every answer is right, just which one is the most right?
I think a lot of people were saying A, B, C, and D was the answer for the first one. Less likely to be skin.
Oh,
That was
that's what it.
that was my impression of it when
Yes.
I saw the chat. I saw a lot of A, B, C, D because I think people were shying away from skin, but thought all the other were good choices. So
Yeah. Yeah,
here he comes.
that was probably a little, he probably could have had all of the above.
Yes.
Would have worked.
Can you hear me now?
We can. You're
Sorry
back.
about that. Can't tell you exactly why I got disconnected, but I did.
Mhm.
Pam, did you go through the rest of the quiz?
I
Survey?
didn't. It was down.
It was down, okay. So we went through number one, we went through number two, right? Did I go through
No, we
that?
didn't
Or
get through
maybe,
two.
maybe you didn't hear that. How many ways can you use to
You were
prevent?
finishing it.
Okay. There are 5 different ways and we'll go through them, the way you can prevent getting SARS-CoV. Number 3, there are no federal legal regulations to protect workers from airborne pathogens. We have been pushing for this since the early 1990s when we faced multi-drug resistant tuberculosis, which is similar to SARS. It's an airborne pathogen. We have pushed and pushed and pushed the federal government to issue a standard to protect workers from this. They have refused. It goes through multiple administrations. So this isn't about one party. It's about the intransience of OSHA. There's no excuse for them not to have legal protections for all workers to protect them from airborne pathogens. It took us a lot of struggle to get the standard for bloodborne pathogens back in the 1980s, and we didn't get it till the early 1990s. We still haven't gotten it for SARS or any other airborne pathogen. This is, and you know, and people make fun of me when I say it, but the name of this disease is not COVID. It's not coronavirus. It is the severe acute respiratory syndrome COVID-2. This is directly connected to SARS-1 and 2 from 2003 when we tried to get the federal government to issue a standard then. So this isn't new. This is old. We've known about this for a long time. And so the fact that there is no legal protection is outrageous. There is legal protections in California because we were able to get OSHA, which is a state agency, to issue a similar standard that we tried to get at the federal level. They did issue one. We are trying to get Connecticut to do that for OSHA, which only covers public employees, who would cover your folks, Bill.
Yep.
It would not cover private sector healthcare workers. It would only cover public sector ones, but it would be a start. So the answer to number 3 is false. There actually is, excuse me, is true. There is no federal legal regulation. How many people, did people mostly say true or false, Pam? You're on mute.
Sorry. A lot of people didn't respond, but some
Respond.
people did say B, yes.
Okay. Well, most people are shocked when I tell them that, because most people presume there would be a standard to protect them from this deadly disease, but there isn't. Unfortunately. So if you have any expectations from this workshop, we'd be interested in hearing what your thoughts are. What did you think about when you were coming to this today? What did you want to learn? What are your expectations? If you have any thoughts you want to put in the chat, you feel free to do that. I mean, how many people do we have clicked in? I saw 25. Now I see 17 now, right? If people want to unmute and talk, I would much prefer actually talking to people than hearing myself. So if people want to unmute, they should feel free to do so. Pam, you said a little bit already about what ConnectiCOSH is, right?
That's right. That's right.
And we talked about this already too, right? Objectives.
Steve, I'd like to see where.
Yeah.
I'd like to see where OSHA and Joint Commission and stuff like that. Where have they been over the past year that we just went through fighting without them?
Invisible.
You know?
Invisible.
And that's a big problem. So what can
It's
we
a
do
terrible
about this?
problem. It's an incredible disservice to workers that OSHA wasn't citing employers for not giving them the right respiratory protection. It's a terrible disservice to OSHA that they didn't issue what's called an emergency temporary standard, which is what they could have done. Could have done that a year ago, and they didn't do it. Where's Joint Commission? Unfortunately, Joint Commission is always behind the curve. We know that. Joint Commission has requirements for under environment of care that requires every hospital be prepared for this. There's absolutely no excuse why every healthcare facility wasn't prepared for this pandemic, because I could show you requirements dating back to the early 2000s, right after SARS-1 and right after H1N1 and avian flu, that there was requirements that hospitals be prepared for pandemics under Joint Commission. They got money for this back then. And the idea that they didn't have supplies of personal protective equipment, that they didn't have plans in place, is a failure by lots of people. You know, I'm not gonna be political about this, because it comes in all stripes. Political stripes, that is. Not stripes like your shirt, Jennifer. It comes in all stripes, because quite frankly, the lack of leadership is why workers have died from this, and why 500,000 people have died from an airborne pathogen that we knew how to protect people a year ago, 2 years ago, 10 years, 15 years ago. Why the 500,000 people died is just outrageous to me. I talked to people at CDC and NIH who would say that all this should have been as a bad flu season. And the regular flu season, between 20 and 60,000 people die every year from the regular flu. And that all this should have been from SARS is a bad flu season. It shouldn't have been the nightmare that it's become. So I don't know if that answered your comment. I know it was a rhetorical question, Bill. So where have they been? They've been MIA is where they've been.
Well, so what could we do? This upsets me very much that, having a grandmother who died of TB in the 40s
Right.
from being a nurse.
Mm-hmm.
And then my mother came down with TB 20 years later because she took care of her mother. And that bug is in my system because my mother came down with it when I was a year old. So we knew, and it just
Yes.
upsets me. We had more PPE available to us for AIDS when I was caring for AIDS patients, which was not airborne. And this is shameful, shameful. And it's still shameful. We still shouldn't be wearing the same mask for 12-hour shift.
That's correct.
We know, and we're
Gail,
still doing it.
if you look on the box, it says disposable, doesn't it?
Yes, our trash cans should be overflowing.
That's correct. That is correct.
That's what infuriates me, is why when they tell us we have enough PPE, we're still not meeting standards of what we know is correct from evidence-based knowledge over since we made so many mistakes years ago.
You're absolutely correct, Dale. And the idea that you aren't changing your respirator between patients, just like you change gloves between patients. How many people would want to have you wear the same glove all shift? That would be outrageous, wouldn't it?
Well, I'm sure it was happening.
It was. Yeah. No, and it was because we were able to successfully get a standard around bloodborne pathogens that healthcare facilities are better prepared for bloodborne pathogens now than they used to be. But we don't have that kind of legal muscle right now when it comes to airborne pathogens, and it is outrageous. And you're talking about TB in the 40s. You're right. You're right. You know, I came to work for the union in the mid 1980s, and we were dealing with bloodborne pathogens then, and we dealt with airborne pathogens in the early 90s with multi-drug resistant tuberculosis. And we've known since at least the early 90s, and as you say, going back farther, how dangerous this is and how necessary it is to protect your lungs. You have a legal right to have your lungs be protected your entire shift. Failure to give you a properly fitting N95 respirator or better does not adequately protect your lungs. Surgical masks are for surgery. Surgical masks are to protect the patient from the doctor and the surgical team during surgery so that if you cough, you don't cough into their open wound. That's what they're meant for. They're not meant to protect the wearer. All those workers that did rescue work in Katrina, you saw pictures of people going into homes wearing surgical masks. All they were doing is making sure that the dead bodies in those homes didn't get the flu from the workers coming in. Workers doing rescue there got what's called the Katrina cough. And it's because of their exposure during rescue work during Katrina in New Orleans. None of this is new. I'm not giving you information that just came off the presses. We've known about this for years. So our job here today is to give you some information about this and to hopefully encourage a discussion so that you can identify what concerns you have and help you develop solutions and inspire you to take action. You know, the first thing I would say at the end, I'll say this now, but I'll say at the end is we need to call the co-chairs of the labor committee and encourage them to get a OSHA to issue an emergency temporary standard for healthcare workers, state workers, because that's something that's within their control. They can't control federal OSHA. They can control OSHA. OSHA issue what's called an ETS, emergency temporary standard for airborne pathogens. And I'll be happy to share some information with Jennifer so she can share with everybody after. Any other thoughts? Well, these are our online ground rules, which are similar to our regular ground rules and workshops. We want you to respect each other. Place yourself on mute until you're ready to talk. If you want to talk, you certainly should feel you to do that. You know, we all find that our dogs, our pets, and our kids like us more when we're on Zoom or on the phone. So if you could limit that distraction, that would be good. We want you to ask questions and participate. We want you to let others participate, and so limit the crosstalk. Use the chat to raise questions if you have any. Do those ground rules make sense to people? Fortunately, we're all experts at Zoom now, I guess, right? Either from our family or for work. So an overview of worker rights. Legally, you have a right to know about what you're exposed to. You have a right to protections to certain kinds of protections, and you have a right to compensation. Now, just because you have these rights doesn't mean it's easy to enforce them, but I wanted to make sure that we say that to folks. Connecticut Public Employee Safety in Connecticut. You have OSHA, which is 50% funded by the federal government. It's a state agency that regulates all public employees, state and municipal workers. It has to use the same standards that federal OSHA issues. It covers, and it does have the capacity to establish tougher standards, which is what I was talking about an emergency temporary standard. So OSHA does not have any standard either around airborne pathogens like California does. Under Connecticut law, when it comes to hazardous toxic substances, if you're exposed, you shall be informed of the nature of those hazards. They're required to use what's called engineering and administrative controls whenever feasible. Engineering and administrative controls and health and safety language means ventilation and proper policies. So it means that there should be adequate ventilation in all your workplaces to protect you from airborne pathogens, which would mean in a hospital, it would mean that they should have negative pressure rooms to put patients into. And those negative pressure rooms should have adequate pull, so they pull the air out of the building, not out of the room into the ventilation system, but out of the building. The same way they're supposed to required to do for bathrooms. For bathrooms, it's for odor purposes. For this is for health and safety purposes. When engineering and administrative controls are not feasible, they're required to use personal protective equipment, which means things like respirators, not surgical mask. Surgical mask is not considered a personal protective equipment under the law. It's been interpreted to have been allowed to be used like that now, but it's not under the law. It's not really a PPE because it doesn't create a seal on your face. To properly wear a respirator, you must create a seal from the top of your nose to the bottom of your chin. If it doesn't create a seal, it doesn't protect your lungs. Do people have any questions or comments on what we've covered so far?
Hi, my name is Logan. I'm a field rep with AFT. We've had situations where they do the fit testing and the members have told the person, well, I can smell it.
Right.
It's some sort of smell, and I believe that means that it does not fit, right?
That's correct.
And the person has said, well, this is the only size we have.
That's illegal. They're required by law to have 2 different sizes and 2 different styles.
Okay.
And Logan, you're almost in my boat. You can't wear one with that beard.
Yeah, well, fortunately for me, I don't need to, but.
Right. Actually, I shaved my beard off right when this first happened. I only grew back this part because my N95 does connect up to my skin. If you have facial hair, you cannot get a good seal on an N95. But no, they can't. And actually, you know, it's interesting you use the words you use because people say, I failed the fit test. You can't fail a fit test. The respirator failed you. You didn't fail. Your face is your face. If the respirator doesn't fit your face properly, that's the respirator's fault, not your fault. But people commonly say that. And that's not unusual. What you said is that they'll say, well, we can't do anything about it. That's actually not true. Legally, they're required to have multiple sizes and multiple styles. There's the kind that commonly are called the duckbill. That's like a Kimberly-Clark. And then there's a 3M, which is a round blue one. They're different styles, and they all come in sizes. So they're required to have multiple sizes to make sure it fits your face. That's what they're required to do.
I do have a question.
Yes.
I am a health unit coordinator at a hospital. I was told I cannot have an N95 because I am not doing an aerosol procedure.
Right. I know, that's ridiculous.
Okay, like now it's like.
That's the recommendations. That's one of the recommendations the CDC put out. And aerosol producing procedures are not the only thing that creates aerosol is in the air. Obviously, coughing and any kind of breathing does. So quite honestly, anybody who's in a healthcare facility anywhere is at risk, not just people who do those procedures. And they're hanging their hat on a 1940 study that's been long discredited that talks about this 6-foot rule. That says if you're within 6 feet of somebody that you're doing a procedure with, that you're at risk. And that's because they're only looking at droplets, not looking at aerosolized particles. The evidence is that aerosolized particles can cause these diseases too, not just droplets that theoretically are so heavy that they fall within 6 feet. That's the argument they're making. But that study has long been discredited. The New England Journal of Medicine said that aerosolized particles can hang in the air for up to 3 hours. And MIT did a study that says SARS particles can travel as far as 26 feet. So it's not 26 feet, and it's not only doing that procedure that puts you at risk.
Can I ask a question regarding that? My name
Yes.
is Leody. I'm a nurse.
Yes.
So given those questions and those concerns from those two people regarding wearing protective equipment, what are their recourse if their supervisors are telling them they cannot have, and they feel that they are at risk? Even if you say that OSHA, no, that's not right, that's illegal. But where do we go from there?
Well, OSHA,
What kind
OSHA
of
does not
support do
say.
we get?
The unfortunate thing, Leody, is that OSHA does not say it's illegal, and that's what lots of employers are hanging their hat on. Unfortunately, OSHA has not stepped up to the plate.
So
Here's
what
what
good
I
is
would
OSHA
suggest.
then if they're not doing anything? We need to protect ourselves. We need to protect the employees.
Yep.
And so what is OSHA doing right now? I honestly, I don't agree with the new guidelines regarding masks because we don't have the majority of people vaccinated yet.
Correct.
So we are still all at risk.
Correct.
But in order to protect the people who are taking care of patients, what is the role of OSHA if they cannot formulate some rules? If they cannot make
They could
hospitals
formulate the
agree?
rule. They choose not to. It's not a question of whether they can. They could, but they choose not to.
Why do they? Why is that?
Because unfortunately, they're leaning on the CDC as well. This is a long struggle, Leody. We've been dealing with the people at CDC and infectious disease people for decades now. And unfortunately, there's lots of people who are very smart and who know a lot about infectious diseases, but who know nothing about how to protect workers on the job. And so we have had this struggle the CDC did not support our fight for the bloodborne pathogen standard back in the 1980s. They said, we don't need a standard for this. And unfortunately, that's because their thinking is not about protecting workers. And that's the problem with lots of the recommendations the CDC has come out with the last year, is that they don't think about protecting workers. My job has always been how do I protect workers to make sure workers go home safe at the end of the day? Anything short of a properly fitted N95 respirator is not going to protect you from the airborne pathogens in a hospital. Anything else is second best. Why would you want second best? Why wouldn't you want the best? And so the answer is, what I would say to you is this is about organizing. It's about educating your coworkers and organizing. And what I encouraged my members to do when I worked for the union is anytime you faced a hazard that didn't have a standard, you fill out a hazard exposure form. You put it in writing. You make the employer's lawyers get nervous that you've documented your exposure. And so that if you put it in writing that I think I may have been exposed to an airborne pathogen because I didn't have proper personal protective equipment, their lawyers will get nervous. And maybe that'll help them respond better. That isn't the answer you wanted, I'm sure, but that's the best answer I can give you. Unfortunately, until we get a standard that protects workers, our hands are tied in some ways, because I know the employer's first response is going to say, okay, what standard, what law are we violating? And the answer is they're not violating any law because OSHA has refused to issue one, which is unfortunate. It's worse than unfortunate, obviously.
Steve, I just want you to be aware of time.
Time, I know, I'm
Percent.
sure, I'm
Yes,
sure.
and I know, you're getting, I know you're gonna want to get through everything.
Yep. All right. So at the risk of cutting off questions that I know that are good questions that I know I'm going to want to answer, but at the risk of doing that, I'm going to try to go forward with the rest of the presentation. And if you have additional questions, there'll be other places to ask, okay? I want to make sure we answer every one of your questions if we can. So look at this quote: the transmission of airborne infectious diseases is increased when there is poor indoor air quality. I'm sure that's not a radical concept to anybody here. Evidence is increasing that inadequate or inappropriately designed ventilation systems in healthcare settings or other crowded conditions with high-risk populations can increase the risk of exposure. Fresh air ventilation is an important factor in contagion control. Who do you think said this and when? Anybody have a guess? I had a number of people in other class say Fauci said it last year. He could have said it last year, but it wasn't Fauci and it wasn't last year.
Probably very, very long time ago.
You got that right. 1993. It seems like generations ago. 1993, and this was put out by the American Lung Association, the EPA, and the American Medical Association, of all people, right? I tell you, this is not a new story. This is an old story. This is like Groundhog Day. We have struggled for indoor air quality standards since I came to the union in the mid 1980s. We organized our members up in Maine and New Hampshire, state employees, to go after indoor air quality problems in sick buildings throughout those two states. And we got legislation passed in both states back in 1989. We did a petition to OSHA. We proposed federal legislation. We did postcards to U.S. Department of Labor. In 2010, we did get a standard for workers in California, only California, unfortunately. This is not a new problem. ASHRAE is the trade association of the ventilation people who run your ventilation system in your healthcare institution or your state building. This is the standard that they're supposed to follow. It's not a legal standard, it's a recommendation, it's guidelines. You know what this is like? This is like saying that every speed limit sign on the highway is a guideline, not a limit, right? There's no law that requires this. I stuck this in here because it's interesting. You know, my wife is always chagrined about how much paper I've saved over the years. I saved this from 1989. And what's interesting about this recommendation is look at the last one on there. This was for schools. That people may remember there used to be smoking rooms in schools, right? This is where teachers would go, and there were smoking rooms in hospitals where nurses would go, right? This is what ASHRAE said: how much extra air you need to make that clean. To make that air clean, you need 4 times the normal amount of air to make that air clean in a smoking room. So if smoke causes that, you can imagine SARS is the same thing, right? That's how much air that they said back then you needed for a smoking room. Any questions or comments? Heating, ventilation, air conditioning systems. These are complicated systems that are not so easy to understand sometimes. It's important to some things to keep in mind, that where the air comes in matters. I once did an inspection at Mattapan Hospital up in Massachusetts. We had people getting sick. The intakes for the ventilation system were right next to the emergency room. Guess what was right next to the emergency room? Ambulances with their engines idling. They were sucking carbon monoxide into the hospital. Gee, I wonder why our workers were getting sick. So where the locations are for the intake matters. Making sure the damper controls, that's how much fresh air is brought in, matters. I once did an inspection at Ridgefield High School. Workers were getting sick. They had some company, Honeywell, running the system off property. They did it they said the computers will tell us how much fresh air is coming in. I walked around the roof of the building. All the damper controls were rusted shut. They said they were getting 25% fresh air. They were getting no fresh air. The computers were wrong. The computer sensors didn't pick up that the dampers were rusted shut. Making sure that you're getting enough fresh air in there is important. Where the supply and return vents are located is very important to making sure that you get airflow into a room. Making sure that you have ductwork that brings fresh air into the room is important. Making sure that you limit the amount of chemicals that you bring into the building through things like what's called integrated pest management, rather than spraying pesticides everywhere, that you find another way to get rid of the pests. That you do an audit of the cleaning chemicals, because believe it or not, cleaning chemicals can be quite toxic. And if they're applied in the wrong way, in the wrong places, and there's not enough air to brought in, they can make people sick. These are all things that you should consider when it comes to your ventilation system. This is a very simple version of a ventilation system. You can see where the air comes in from the outside, where the compressor is all the way to the left. You see that there's things that either cool it or heat it depending on the time of year. It then sends that air out to ductwork that goes into your work area, supplies the air, and there should be a place where the air leaves. It's important that they be properly maintained. It's important right now that if you have patients who have SARS or any other airborne pathogen, that they be in what's called a negative pressure room, that negative pressure room is not connected to the system, that it is directly vented outside the building. It needs to have enough air to make sure that no air can get out of there. These are some things to consider when it comes to maintenance, that the system should be inspected regularly, there should be proper cleaning and servicing. I've had problems in dealing with Legionnaire's disease because its systems weren't properly serviced. There was a accumulation of water, standing water. Make sure the system is balanced, and that way you don't have hot and cold areas, enough fresh air coming in, and then you have the right filters. Follow the specs for the manufacturer. A lot of people will, first thing they want to do when they don't think the air is good, they want to do testing. I've dealt with lots of these companies that come in and do air quality testing. I'll tell you, it's a license to make money. They'll come in and they test. The question is, are they testing in the right locations, the right time of day? What kind of monitors are they using? What are they looking at? Are they looking for carbon dioxide, which is what we all breathe out, which is an indicator there's not enough fresh air coming in? And do they put together a written report with recommendations that you can review? I'll tell you one thing about carbon dioxide. I'm going to go off script here for a moment. When I got hired back in 1985, I started doing carbon dioxide testings of offices for air quality. And I would always do a test outside to get a baseline on carbon dioxide. Back in the mid 1980s, carbon dioxide levels outside in fresh air were between 300 and 320 parts per million. Do you know what they are now? 400 parts per million. That's in the 30 years that I've been doing this job, 30 some years. So for those of you that don't believe that there's anything going on in the environment, I can tell you firsthand that that's one thing I know. There's higher carbon dioxide levels in the air, fresh air now than there were 35 years ago when I got hired. So, and we can argue about where it comes from, but I can tell you that there is a difference. Ventilation system checklist. Do you have a coordinator? Do they drain the chiller to make sure you don't have Legionnaire disease problems? Do they check the filters regularly? I can't tell you how many times I've checked filters and it says change every 3 months and they hadn't changed it in 2 years. Do they check that? Do they balance the system? Do they make sure there's enough fresh air coming in? Do they make sure the airflow within the room is adequate? Do people have any questions about ventilation systems? I know I'm covering a lot, and we're going to make sure we'll share this with Jennifer, right? So she can share this with everybody if they want it.
Definitely. I can send a PDF over.
Yep. When I think about how to fix this, and that's the most important part of this, is how to fix this, not just to talk about it, but how to fix it. I think of 4 things that I've worked with my members over the years, and that is research, which is you document that there's a problem, so it's harder for the boss to argue against you. This comes with surveys of workers of their health problems. It comes from information requests. We then try to educate our members about this. We try to use organization. You know, in Connecticut, no matter what kind of workplace you're in, whether it's public or private. If you have 25 or more employees, they're required to have a health and safety committee. As a union, you have a right to be on that committee. Use that committee to pressure management to get things fixed and to take action.
I have a question, Steve.
Yes, go ahead.
My name's Janice. I'm Temporary Nurses Union President. So our Health and Safety Committee, they allow 2 people from the union to be on that meeting on a monthly basis. If one of us can't go and I say like I want a substitute person to go, unless I give them 48 hours notice, they won't allow that nurse to go.
How many workers are on, how many people are on the committee overall?
About 24.
So you only get 2 out of 24. Are there other bargaining units there?
No. Well, actually, I think there is, because they have the housekeepers there. So that it's from, you know, housekeeping all the way up to senior leadership. So I do think there's 2 or 3 different unions. Tina, do you know if the nursing assistants have anyone on that meeting? You're on mute, Tina.
Yeah, Janice, I can tell you this, the law requires there be equal number of management and workers.
Yeah, so I guess there is. I'm gonna take notice a little bit more the next time I go, but thank you. But that 48-hour thing, I mean, that
Well,
seems silly to me.
I would agree with you. I think that's a question of negotiations. I think that there's nothing in the law. The law is silent on how much notice you have to give if you can't come. But it's up to management to make sure that it's a balanced committee. So I think we should
Thank you.
ask them to justify how they can't have if one of you can't come for some reason or other, why you can't have a substitute. And if they don't give us a good reason, we can always file a complaint with the Division of Worker Comp Commission. I'm not having a lot of confidence they'll do anything, but that's a reasonable request by you. I can tell you that, obviously.
Yeah, okay, great. Thank you.
But the law is silent on it, unfortunately. Any other questions? Well, what I'm interested in is finding out what you thought was useful from this class and what are you going to do? What are you going to do with this information? So,
Steve, this is Bill Cunningham. I have a question back to the respirators.
yes.
One point when the supply was low, they placed N95s from Home Depot. Is there a difference between hospital grade respirators and these ones from Home Depot?
Yes, there is. Not necessarily a big difference because lots of the N95s that construction workers use are very similar to hospital grade. They're not a huge difference, but the key is, was it an N95? What did it say on it that it was NIOSH approved? Did it have a number on it? Because lots of times Home Depot and some of these dollar stores will sell something that looks like an N95, but it's not. If it doesn't say NIOSH approved, NIOSH is part of the Center for Disease Control that deals with worker safety. It's the National Institute for Occupational Safety and Health, and they have to certify that it's approved. And by that, it means that it actually creates a seal on your face. If it doesn't create a seal, it doesn't protect your lungs. And that's why NIOSH has to, they test them to make sure that that's why all these Halloween masks that people wear is not adequate. You know, these cloth masks don't create a seal on your face, so they don't really protect your lungs. They do reduce other people's exposure to you, that it will do. They act like a surgical mask, but they're not a respirator.
Thank you.
You're welcome.
Hey, Steve, I would have liked to ask a question about actual reporting or
Yeah.
getting to ConnectiCOSH. How easy is it to actually fill out a report, a complaint? What are those things called? Are they easily accessible on the ConnectiCOSH website? What's the
You
best
mean
way-
ConnOSHA, right?
I'm sorry, ConnOSHA.
I wish we
website.
had the power bill to do something, but yeah, you mean ConnOSHA. Yes, they are. And ConnOSHA, there are people at ConnOSHA who are decent people who want to do the right thing, who will try to help, but they don't have a standard around this, unfortunately. The problem
is
when you
it-
don't, The problem when you
sorry.
don't have a standard, I'm sorry, go ahead.
You might have been answering. I was gonna say, has there been any luck using the general duties clause?
Yes. That's what I was about. You read my mind. That's exactly where I was going to go. There is something called 5A, which is a general duty clause, which says anything that's a recognized hazard is illegal. Is this a recognized hazard? Yes. The question is, will OSHA be able to convince lawyers to go fight for us on this? We've been able to get citations from federal OSHA without a standard around workplace violence, but because we found people in the U.S. Department of Justice who would be willing to stand up and say, we'll go to court over this, because employers fight this. When there's no standard, they say, you don't have a rule about this. How can you cite me for this? I don't know how anybody could say with a straight face that this isn't a recognized hazard. But if there's no standard around it, so it would have to be a general duty clause. So it'd have to be not just proving that there's a problem, but that it's so egregious that the lawyers will fight for it. And therein lies another challenge we have, is that the lawyers don't necessarily fight these cases for us. I have for years put together the list of number of fatalities in the workplace every year for Worker Memorial Day, which is April 28th, which is a day to remember everybody who gets hurt on the job or dies. And I can tell you that the number of lawsuits regarding those workers who died are minuscule compared to the number of people who die. And that's because the Federal Department of Justice, under that OSHA's, that's who OSHA's lawyer is, they don't like to go to court over this stuff because it's small potatoes to them. They don't care. And I will tell you that I can't speak for the Attorney General, but it's the state's attorney in Connecticut that can file these suits. And I can tell you, John Conley, who was the state's attorney in my area, years ago, we had Hurricane Gloria where 2 security guards were killed from carbon monoxide. And he tried to take them to court, and Judge Lavery, and I'll remember his name forever, threw the case out, said you didn't prove that this was a common hazard. Carbon monoxide is a known hazard. And these security guards died because the power went out and there was no alarm to let them know that there was carbon monoxide buildup. It was a metals plant in the south end of Waterbury. So these lawyers are hesitant. Lawyers like to win cases. They don't like to just take cases. So they only take them if they think they can win. So unfortunately, we're behind a rock on this. They don't like taking these cases. So the general duty clause is there, and it is a violation in my mind without question, but it doesn't matter what I think. It matters what the lawyers that work with OSHA think. And they're going to be hesitant to do something in general duty clause on this because there is no standard. That's why we need an emergency temporary standard. That's why we need to make them step up and protect workers who from a hazard that we know has killed thousands of our coworkers and tens of thousands of people in general. I can't imagine a more recognized hazard than this right now.
If we do not have all the information on our website is in sore need of changing. We're in the process of doing that, but you can call ConnectiCOSH. Mike Fitz is willing and able to help anybody that wants to file any kind of complaint.
Can I just make a comment for ConnectiCOSH? And I can see if I get your point on, will you have lawyers at the higher level who will take it when this inevitably gets appealed? And I understand that concern and maybe not wanting to spend resources on a thing that won't get finalized later on in an appeal process. But from a union perspective, the citation itself is a huge win. And we're able to organize around that and actually get a lot of workplace changes done based on a citation, even if that citation gets thrown out later. So I'm not sure if that's always like put into your on the agency's perspective, if that's something that's thought about, but I just wanted to bring that up because we've had success making changes based on a federal OSHA citation. It's still an appeal. It may get thrown out. It may get settled. It doesn't really matter. We won changes because we got that citation.
I think you raise a really good point, and it comes down to what I always say to people. It's about organizing. It's not necessarily about what the law says specifically. It's about organizing. If you get workers in motion, you can make management do the right thing. You're right.
Good point.
I think this is a good point too, and it would be wonderful to be able to have some type of seminar / class, something to get us motivated and work on making this right, because I feel like we're kind of at a standstill, and I would love to motivate my union members to do something, and everyone is really caring about COVID and SARS and all this, and nobody wants to be dying from this lung disease that's preventable. So I think this is a good aspect to maybe get people motivated and maybe jump on this, and maybe
We
AFT
will be
Connecticut will
happy
do
to
it.
lean into this, and we'll be happy to get you information about how OSHA could do a better job of protecting public employees in Connecticut. We're going to be doing some OSHA, some forums with both federal OSHA and OSHA in June. We will let you know when we do those, so you guys can come in and raise this along with other people who are going to raise this. Yeah, we need to keep pressure on them. You know, just because we haven't gotten it yet doesn't mean we're never going to get it. You know, we've won a lot of things over the years after being persistent. So if you've got folks who are willing to help us on that, we are looking forward to that. Absolutely.
Yeah, good, thank you.
Steve, I have a question on exposure. So our employers, I don't know how the other hospitals were, but basically stopped even telling the workers if they were exposed. Not even just the workers, they didn't tell patients they were exposed either in the hospital. So that, I mean, going forward, they still are not doing it. So if that is what they're supposed to do, aren't they violating the law there?
No, they're violating Joint Commission there. Environment of care requirements require some kind of notification when it comes to airborne pathogens. That goes back to the TB stuff in the early 1990s. See, standard precautions or universal precautions, depending on what you want to call it, for bloodborne pathogens doesn't require that you be notified that your patient had a bloodborne pathogen, because you should be using universal protections. Airborne pathogens are required to have a sign on the door. I can't tell you how many times I've had members, healthcare workers, tell me they found out 3 days after the patient died that the patient had tuberculosis or something like that. And they had to go in and out of the room, and they were never told that they should be wearing any kind of respiratory protection. That is a violation of environment of care. And quite frankly, depending on the healthcare, are you a private sector hospital, or you work for the state?
Yale, private.
Yale, private. Well, you know what? Yale does care what Joint Commission says about them.
Yeah, they tell us that all the time.
Yeah.
And then why don't they act like it?
Well, you know, the thing that's always true, I'm sure this is true where you are, is that you know when Joint Commission is coming in because the staffing levels go up. That's true in lots of facilities.
Yeah, I wonder when they're coming around
Time
again.
doing that now.
What?
I think they'd have a hard time doing that now.
They would have a hard time hiring people. You're right. You know, I have to laugh when I hear about all these hiring bonuses. Why don't you just pay people decently in the beginning? You know, hiring bonuses. Imagine that. Just pay people, show respect to people and pay them decently at the beginning. That's all you have to do. I know I'm preaching to the choir on that, right? Any other, what would you say were some of the most important points that we covered here today?
I think the fact that we are so behind in things, and, you know, in general, that I'm actually really disappointed in OSHA. I didn't know that that they were so useless.
Well, the unfortunate thing is the people who care don't have the power, and the people who have the power don't care, unfortunately. There's good people at OSHA. There's good people at ConnectiCOSH. I've worked with them for years. There's people who legitimately want to protect workers, but they don't make the policy of the agency, you know? Unfortunately, the folks at CDC have made this hard for us for a long time. I can tell you this. Let me ask you a question in terms of what your rights are. have had most of your institutions issued some kind of personal protective equipment, correct? Something, either gloves or some kind of thing for your face, right?
Somebody also, Steve, pointed out that the gowns, they wear the same gowns all shift too.
That's bad infection control.
Mhm.
That's bad infection control. Well, I can tell you this, if they issue you any kind of personal protective equipment or anything that they claim is to protect your lungs, they are required to do something called a hazard assessment. And this hazard assessment requires that they analyze the nature of your exposure and how this is going to protect you. I think one thing you can do as the union is you can ask for a copy of those hazard assessments. And I will tell you this, and I can share it with you. I did get one certified industrial hygienist who's a professional to do a hazard assessment for one of my members who worked for a state institution. And he basically said these cloth masks are for shit. This was a custodian, and he said that if they work in an area where there might have been a SARS patient or SARS-CoV person positive in the previous 8 hours, they needed to have respiratory protection, nothing less than an N95. This is an actual honest hazard assessment. That's what they all should have been doing from the beginning. They didn't choose to because it was inconvenient. I've joked around and said that my 3 hours from the New England Journal of Medicine and my 26 feet from MIT are what I call awkward facts. Al Gore had his inconvenient truths. I have my awkward facts. It's awkward to tell people that because that means that we all needed to have protection from the beginning. And we weren't given that. And we weren't even told that. And as a matter of fact, there's a reason why they didn't call it SARS. The World Health Organization made a judgment they were going to call it COVID-19 because they thought saying severe acute respiratory syndrome might set off too many panic bells in Asia because they had to deal with SARS in 2003. So they wanted to prevent panic by not telling people what the name of the disease is. So if you wonder why I had a stroke, now you know why. The last year has been hell for you. It's been hell for me too, because I've had a responsibility to my members to try to keep them healthy, and it's been very difficult. Knowing what we've gone through before and seeing it continuing to happen is very frustrating. And knowing that people are at risk, unnecessarily so. And a lot of you were told they couldn't get N95s. That's also not true because there were millions of them being sold overseas. 3M was producing 25 million N95s a day. And it wasn't that they were inaccessible, they just cost too much. It's all about money, not surprisingly. And N95s now going at $5 an hour, $5 a piece really is outrageous. These things used to cost 75 cents each. Surgical masks used to cost 25 to 30 cents each. This is pre-SARS. So we have a lot of work to do. And my suggestion to you all is to document your exposures, put it in writing, request those hazard assessments, and make them put it in writing that they've actually looked at the hazard and make sure that they're actually trying to protect you properly. And as was mentioned by Logan, it's as much about organizing as it is about the standard. The standards aren't tough enough, but that doesn't mean you can't organize for it.
Okay.
Any other questions or comments? I apologize that we went longer than we were supposed to.
Thank you so much, Steve and Pamela. This has been awesome. Really appreciate it.
We'll be letting you know. I'll send you a PDF of this, and we'll be letting you know when we're going to start scheduling the OSHA listens. We actually had a couple sessions because somebody requested it from Steve's old union, and had started doing some discussions about some aspects of infection control and some
Yeah,
of the
what we
other
were looking
issues.
at there
So,
was gloves.
Yeah.
that lots of people who have been handling these disinfectants for SARS have not been told how dangerous they are. They've not been given the right gloves to use to do the cleaning. And they're all rubber gloves are not the same. There's 9 different kinds of rubber gloves. Most people don't know that. So they were issued what was cheapest. They weren't issued necessarily with the right ones.
What kind of gloves should they be having?
It depends on the disinfectant they're using. If you look, I did an analysis of these the safety data sheets for these disinfectants, and every one of them is different. So nitrile might be okay for one and might not be okay for another.
Steve, I have a question.
Yes.
We have a bunch of global grievances against the hospital over the whole COVID issue. And one of them is a failure to include the union in the COVID response. And the other one is lack of PPE and safety. These are going to be going to arbitration. Can we use you as an expert witness in arbitration?
Well, I'll be happy to help you with it. You can use me, but I will tell you this, because I wasted my time in college and studied political science and economics. I didn't study any of this stuff in college.
Okay.
So the first thing the lawyer from management's going to say is, what what public health degree do you have? And the answer is, I don't have one. We had members who had an arbitration around occupational stress, and I put together an entire presentation for it, and they were going to use me as an expert witness. And the first thing they did is disqualify me because my degree is not in public health or anything like that. I'll be happy to help you with it. And I'll be happy to work with whoever you do get. And maybe we can find somebody who does have that MPH or some kind of initials after their name. But I might not be helpful to you. I can be helpful, but not in the way you want.
Okay.
Okay.
Well, I definitely will get back to you.
Okay.
Steve,
We
would you-
do have a connection with one of our DPH, one of our board members is from DPH. And
Yep.
maybe there is either she, if not her, she may have somebody else that could be possibly helpful alongside Steve. So Steve has a practical knowledge that a lot of people with the letters after their names don't necessarily have. But
Just so you know that even though I didn't make the presentation, I gave that presentation to a colleague and he did it, and we won the arbitration. And so the joke was, he said he could say anything as long as I wrote it up. So
yeah, I'm sure something can be worked out.
I'll be happy to help in whatever way I can. I'm just telling you that I would not be useful as an expert witness because I don't have a degree in that stuff.
I appreciate whatever help I can get.
Yep.
Good. Okay.
Any other questions? Well, thank you for your time. We got a lot of work to do, don't we?
Yes.
You have to educate your coworkers so that they understand what's at risk here. Many of them instinctively know it. Some of them need more facts to help them want to organize. And it really does come down to what Logan said. It's about organizing. It's getting people to stand up, use their voice. As it is for everything else we struggle with, right?
Thank you again, Steve and
Thank you.
Pamela.
Thank you so much.
Appreciate it.
Take care, everyone.
Stay healthy.